Hello and welcome to this edition of Strong at Home. I'm Dr. Brenda Murphy and I'm an educational psychologist, and we are here to provide information and help so that you as a parent or grandparent or caregiver of children who are in school-age children, that you can have strength in what you're doing. And today I'm very excited with the guest that we have because it is one area that parents often struggle with. It's like, have you ever said to your child, "Don't you hear me?" Well, our guest today is Erin, Dr. Erin Plyler. Hello, Dr. Plyler. Thank you for joining us. And I wonder, have you heard from time to time in your practice parents say, "Well, my child, I talk to them, I question them, but they just don't hear me"?
Absolutely. And thank you for having me. I think it's a very important topic that there is some confusion about. And so I'm excited to share some of my knowledge with your listeners, and hopefully this will be beneficial to everybody.
Oh, absolutely. Because as I was preparing, I started asking questions about myself. So I think it's a very, very important topic. Well, Dr. Plyler, you are an audiologist.
Yes.
And could you explain a little bit about your background and how that comes to bear on raising and teaching children?
So I have been a pediatric audiologist for over 20 years.
Oh.
My first 5 years, I was in the educational system. So I was an educational audiologist. Then I was in Louisiana. We moved back to Tennessee, and I've worked at the University of Tennessee in the audiology program for 18 years.
Oh.
And what I do there is I teach graduate students to be a pediatric audiologist. And so my kind of specialty is pediatric hearing tests, pediatric amplification, educational audiology, and auditory processing.
Oh, that's a big field. So that's in the Department of Speech and Hearing. Is that the department that you're in? Because there are lots of subcategories under that. And just for my edification, what would be the difference between an audiologist and a speech language pathologist?
So the audiologist is the person or the professional that is responsible for testing hearing. And the speech therapist is the professional that has the specialty of doing therapy.
Oh, okay. So you work together.
Yes. Yes. And we work very closely.
Right. And also sometimes you bring in people like myself, educational psychologists, because in reality, we are all a team to help develop that child into the great potential that they all have.
A multidisciplinary approach is really the best way to manage our children.
Yes. Yeah, absolutely. That's something here at Sail Away that we have advocated for years and years and years, is that when children come to us in our micro schools or in our home schools, we encourage them to have the kinds of professionals that can help, because if you're not hearing really well, how is that going to impact your education? So how will that impact the children's education?
Are we now going to speak about peripheral?
Oh no, we're going to wait. Oh, that's our topic for next. But let me. What we're going to talk about today is what I'm thinking about my children, and I'm thinking about, honestly, some of the parents that come to me for educational consulting, and they list several characteristics that are going on with their children. So I think it would be good if maybe we put a slide up with some of those characteristics that children who may be having. So this would be children, if they are normal, they have normal hearing, normal auditory experiences. And so these kids are more than likely, it's not going to impact their cognitive development. And oftentimes I have parents who come to me and say, "I've got such a bright child, but they're not doing well academically. What can I do?" So that's when I would say, have you seen Dr. Plyler at UT?
Yes.
So these are some of the things that we would have been thinking about. So we'll talk about peripheral hearing next, because that's a little more complex than just the term itself. But one of the things there, why don't you speak to this list, Dr. Plyler, and maybe some of the times that you have actually seen it, and maybe some of the children that have been part of that.
Absolutely. So when we see a child come in, the first thing that a lot of the parents will say to us is they act like they can't hear. They don't hear very well. And then we will go and do a hearing test, and we find out that they're actually hearing is completely normal.
Yes.
They act like they say huh a lot. They say what a lot. They act like a child that actually has a hearing loss. So that's one of the first indicators that kind of catches the parents' attention.
Yes, yes, yeah. And I know for me that a lot of times those parents are very frustrated with their child because they think it's a behavior issue.
Absolutely. Absolutely. I've had parents who have said they're in timeout all the time, or if they're in school, they're always getting behavior notes sent home. And so they're really managing this behavior because they're not paying attention to what's being said and asked of.
Yes, yeah, yeah. And that's so difficult. And I know parents really, that's a really important thing. So the next point in your list of common indicators, man, that's a big one. 75% are male. Oh my goodness. I have 100% males in my family. I have 5 sons. So
okay. So you probably have dealt with some of this then.
I have dealt with this in a big way. Well, I actually have 8, including my husband. So I don't know which one is the biggest offender.
Yes. And so 75% of the patients that are diagnosed with an auditory processing disorder are males. And the research really leans towards the auditory nervous system is not fully matured until we are 12 years old.
Oh.
And the research is showing that even normal developing males are a little behind that curve.
Oh.
And so we don't expect normal processing abilities until somebody's 12 years old.
Man, that is huge information, Dr. Plyler, because very often in my field of educational psychology, we know that about 10 or 12 is when children become more aware that they are not keeping pace with their peers. And so then other factors start coming into the picture. If it's not a cognitive issue and it's something like auditory processing, what happens at that point is when that's not fully developed, they've already started thinking of themselves as less capable than others, when that's really not the case at all. So this is a huge takeaway for me, is that that system is just not developed.
Mm-hmm.
So 75% of the people diagnosed with this are males. Do they have any reason for that to realize that it's more in the male population than the female?
That's just what the research is showing, is that their central nervous system just matures a little slower than the females.
Very interesting. Mm-hmm. Oh my goodness. That's something I would like to research as the mother of 5 sons.
Yes.
Okay, and then the next one is that they exhibit difficulty following multi-step directions or a short attention span. How do parents seem to handle this when the multi-step direction is really important in development?
And so a lot of times parents will come in and they'll say, every day we have the same routine for school. I say, go have breakfast and get your notebooks out. And 5 minutes later, they're sitting on the floor and they haven't done the 2 steps that I've asked them to do. And sometimes they'll say, well, you've had breakfast. What else did I ask? And they say, I don't know. I don't remember you saying anything else. And it's the same thing we've done every day, but they don't follow the same plan or the same pattern every day, even though it's the same thing we've done every day. And so the parents get frustrated because they're not, what they say, they're not listening.
Yes.
And the kids get frustrated because they are intently listening.
Yes.
It just is lost in the translation.
Yes. Yes. Oh, that's very revealing, very revealing. So they also have academic deficits, specifically in poor reading and spelling, which is in my area of literacy. So from your perspective as an audiologist, how do those things work together? Because so many people feel that reading and spelling are visual. How does the auditory factor into that?
So a lot of times parents will come in and say, my child is very smart, but they're not doing very well in school. They're not reaching their potential. I really don't know why. Well, if a child is mishearing a word, it's very difficult to spell the word correctly if they've misheard it.
Yes. Yeah.
And so the first thing we have to do is find out, why are we mishearing this word?
Oh, yes. There's a lot more to it than meets the eye, isn't there? Okay, so they can be withdrawn, social isolation, and daydreaming. Oh, what happens? Does this happen immediately, or is this something that maybe as children get older, they start falling into that particular characteristic?
So what happens is over time, they've misheard so many things and responded to a friend inappropriately because they've misheard what was said. And then they're embarrassed. And as they become teenagers, that embarrassment, they don't want to be embarrassed in front of their friends. So they might start to withdraw from their friends to protect themselves from that.
Yeah. Man, this is lots more to this than you would suspect. So also a history of ear infections. I mean, this one kind of makes sense in a way, but is it ear infections from the time they were born or recent ear infections, or how does that play out?
So ear infections are very important. And one of the things that I'll ask the parent is, do they have a history of ear infections? And if they say yes, and we've had 3 sets of PE tubes, it tells me that for a long period in their life, the child's life, they haven't heard the way they should have.
Yeah.
It's almost like when you have an ear infection or fluid in your ear, it's almost as if you're hearing underwater and you're trying to learn and listen to a language that you haven't mastered yet underwater.
Oh,
so you have these good variety of auditory experiences, and those pathways are not maturing, are not able to mature in the way that children without these ear infections would.
Yeah. Oh my, that's really very devastating. Just the thought of that image is, how have those poor children even learned what they've learned if that's what they're facing all the time? So also motor skills may be deficient. Now that one is a little more curious to me. How would motor skills be impacted if there's a hearing loss or problem?
So one thing we'll find out is did your child crawl? And if they did not, then they really lost those crossed connections in the brain. Those are not going to be fully developed. And crawling is one of the only things initially that really targets the crossed pathways within the brain. And so if they didn't crawl, the follow-up questions are they athletic? Typically, no. Do they enjoy sports? No. Are they kind of clumsy? Yes. They trip over their own feet. These are things that we're hearing from the parents, and it all kind of goes back to they really didn't crawl and get that experience.
So why is it important for people to crawl as babies? Why is that? Because some of our viewers may never have understood that. I hear all the time people, I hate to use the word brag, but they often brag, my child didn't even crawl. He just got up and started running.
Yes. When I hear that, I'm like, oh,
Yeah.
Okay. Yes. And so we want them to experience that right-left movement pattern because that is using those pathways within the brain that no other motor activity targets. And we need those crossed patterns for processing to be normal.
Right. And it does take in, and they are processing sound. So even in the movement, it's forcing the parts of the brain to work together.
Correct.
It's sort of like parts would be stuck. It's like in a car, if you have a frozen cylinder. So I don't know, I'm not a mechanic, but
right.
you kind of can see that if something isn't used for a long time, that it sticks. And then when you
right.
go to start the car, you can't, it won't start. So even this motor movement is affecting the ability of our children to hear properly.
Yes. Yes. To process properly.
Process it properly. Okay. That's really a good lead in because we're going to be talking about processing and hearing in our next session, which we will get to. We have one more point on this one, and then we're going to complete this session and we'll come back. Difficulty in background noise. So is that, those are children that just will put their hands up to their ears, don't want to be in crowds, things like that?
So these kids are kids that even in the best circumstances, when it's really quiet, they still misunderstand what's being said. So now you bring them to a restaurant where there's all this noise going on, and the waitress comes up to ask what they would like to eat, and they're hearing all the background noise. Misunderstanding what the waitress has said is going to be even harder than if it was quiet. So when we add a lot of noise to a situation, these kids just fall apart.
Yeah. So what I've kind of heard as we've begun our conversation together is that, especially here, that the way the brain works has a lot to do with hearing, even if that hearing, when you do your test, is normal.
Yes.
Oh my. Well, will you explain more to us about that, those two types of hearing that really are impacting and how parents can see whether it's one or the other? So I want to thank you so much, Dr. Plyler, for being with us. And we end all of our broadcasts because we began at a time that was very stressful. I think parents are still always stressed with a little bit of a prayer for our day. So the Lord bless you and keep you. The Lord make his face shine upon you and be gracious to you. The Lord lift up his countenance upon you and give you peace. Peace, Dr. Plyler, and we will see you soon.
Thank you so much.
Bye-bye.